currently I am the medical director for the weight loss program at Indiana University Health. And my background is that I've been in weight loss for over 20 years now. Before medical school, I have a bachelor's and master's degree in exercise physiology and did that for a while before going on to medical school. I did primary care for a while, and I'm a board certified internist, but about 3 years ago, the medical group that I work with was interested in starting a weight loss program, knew I had a background in this and a strong interest,
Right.
so asked me to start the program, which we did, and then in that process got board certified as an obesity medicine specialist as well. So run a successful weight loss program now. I think personally that I have the single best job in the entire world. I joke around that I finally figured out what I want to do when I grow up. It only took me 40 something years. But anyway,
Hey, good for
so
you.
yeah, we have a great time. And I love helping people achieve their weight loss goals. But as I tell my patients all the time, weight loss for us is secondary. We want to get people healthy. And that's where I get the most joy is sharing that with people as they embark on a new lifestyle. And we can see results in their health very quickly. And it's incredibly rewarding for both me and obviously my patients.
Fantastic. Now, what would be something? Let's give you, if you were giving yourself some advice. Let's say for what you have learned now here in 2014, if you were going to give yourself advice 10 years ago to help people with successful weight loss, what would be three things you would have liked to have known say, 10 years ago?
Avoiding carbohydrates is the primary goal for successful weight loss and health in general, especially the refined carbohydrates. That's absolutely number one, without question. We should be eating nothing but real food. Number two, and number three would be we need to stop fearing fats.
Fantastic. That's great, concise advice. So it would be to limit the carbohydrates. Then number two would be especially eliminate simple carbohydrates or sugars, processed. And then thirdly, to eat
Anything.
real food, and
Yep.
and not fearing fats.
Not
So,
fearing fats is a big one,
so
correct?
let's talk about that because that's
Yeah.
that's something that still so many people, we've been programmed for, as you know, 25, 30 years. It seems like from the U.S. government on down with the infamous food pyramid that, to a lot of our medical establishment, we've been sort of bombarded with this propaganda campaign about, that fat makes you fat, and fat is, it's almost like cardiac problems waiting to happen. It's all about fat. So fat was public enemy number one. So tell us,
Yeah.
how can we convince, for people out there who are still shocked to hear that fat is healthy. What's the best way to explain this to them?
Yeah, we need to have more reformed fat phobic people. But so here's a couple of things that I would have to say. I could talk about fat for 2 hours, but summary of some of the important things. The first very interesting observation, like I always tell my patient, is one of the things when we are trying to solve the obesity and diabetes problem that we have in our country is we need to go back and trace when it started, right? And it started in the late 1970s. Now, there is not one clear thing to blame, right? It really was a multifactorial problem.
Sure.
Fast food really came into being in the 1970s. High fructose corn syrup started being used in everything. But one of the other big things that I always draw attention to is in the late 1970s, and 1977 to be exact, is when our dietary guidelines came out. And
Yes.
that's where fat phobia really began, right? Because the dietary guidelines in America, I mean, it was just for our country, but we all know that it was adopted everywhere,
Sure.
said stop eating fat and start eating the over 50% of your intake from the one macronutrient source, carbohydrates, which we have actually never been able to define an absolute human need for. So we're supposed to eating fats and start eating something we actually don't need. And you know what happened really fast? We got fat and sick. And so we really need to come back to the drawing board and rethink this, okay? And so, one of the arguments that I hear people make is, well, the dietary guidelines are set up really only to be applied to healthy people. And here's my comment towards that. Well, because of them, we really don't have very many of those healthy people around anymore.
Yes.
And the big thing about fat, it really comes down to the single most important thing about fat and why it's actually not the enemy is insulin is central to keeping us from gaining weight and to keeping us healthy. We need to keep our insulin levels low. We obviously have to have some, but if we have a lot of insulin running around, we're sick. And carbohydrates cause insulin to elevate like crazy. And the interesting thing, and this is always fascinating to people when they first find out, fat does not cause insulin to rise. So if we want to keep our insulin low, which is the key to not only keeping our weight down or losing weight if you've already gained it, but to being healthy in general and preventing horrible things like diabetes and high cholesterol, most specifically high triglycerides, we've got to get that insulin down. And the only way to do that is to increase the fat in your diet, because that's the one macronutrient that won't cause it to go up.
Yeah, that's amazing for people. It's the we're so confused about that, and and I love your comment about the fact that if we just look around, there's so few healthy people. It's now the minority, since 2 out of 3 Americans are now overweight or obese, and it's not going to get better doing more. It's doing more of what doesn't work only makes it get worse, right?
Absolutely. So and that's why we've got to change our approach. And, one of the other things I see, if you don't mind me going off just a little.
No, please go on.
We constantly are hearing that, well, if you just restrict your calories, right? So that's the advice we keep giving people. Eat carbohydrates, which are making us sick because they're causing our insulin levels to be sky high. And then, if you happen to gain weight from that really bad advice, which you will, then just don't eat so much, right? Restrict your calories. And, that's pretty interesting too, because as far as I'm concerned, that is a surefire way to long-term failure. Because number one, nobody wants to count calories, right? That's cumbersome. If you've got to do that for the rest of your life, that can be so overwhelming and daunting that it causes people to go forget about it. And then they're hungry and they're miserable, right? So if we just change the content of the diet, we really find that we can take the focus completely off calories. Because when fat replaces carbohydrates, we don't get hungry. So we wind up having, interestingly, some caloric restriction, but it's a little bit on accident, if you will. And then people don't have to think about it, they don't have to focus on it, and they don't have to be hungry and miserable. And then what all of a sudden we have is, hey, it's not a diet. That's a new lifestyle, and it's sustainable.
That's a great point. There's a gentleman in South Carolina who is, I think he's a naturopathic physician. His name is Jade Teta, and I really like he has a book about metabolic control of weight loss and stuff like that, and it's one of my geeky interests. And so he has kind of a soundbite that he talks about. The 3 signs that your metabolism is not working would be immediately are, if you're looking at our diet, is if you're hungry, looking at your hunger, looking at your energy, and looking at your cravings. So he calls it the heck as as kind of a little memory thing. So there's also, you could also soundbite that and say, keep your heck in check, and you're going to be okay. So if we think about it, if you actually are restricting if you restrict your calories, you're going to create hunger, you're going to create energy problems, you're going to create cravings. So,
yeah. Well, and the solution to all that is to stop eating all these carbohydrates and increase the content of fat. When the insulin stays low, we don't get that hunger because it's the elevated insulin that drives that hunger. And
Sure.
Fat really helps with that. And then, the other comical thing about the advice that we've been preaching for so long is So, think about it. Here, energy restrict, so calorie restrict significantly, eat these carbohydrates, and then go out and exercise. You know, so people don't have enough calories to feed their brain when their brain is relying only on carbohydrates. When you're eating more fat and the brain can rely on fat and ketone bodies for energy too, then our brain has plenty of food, and we can do that. We can realistically exercise. So we paint an absolute unrealistic expectation for patients who are supposed to calorie restrict and eat more carbohydrates and then somehow exercise. It doesn't happen, and then people get frustrated, and it creates this vicious cycle that we've gotten ourselves in. And the other thing that is remarkable, and the focus that my practice has really kind of become a big diabetes focus. That is probably the most wonderful part of what I do right now, is take care of these patients who have diabetes and not control it. Our goal is never diabetes control. It's diabetes resolution. And the thing is, yeah, it happens. And so it's not dramatic. I don't like to be this crazy Dr. Oz. It's a cure. It's a cure. I don't like to use that kind of lingo, because what we find is it's not a cure. If you eat carbohydrates again in excess, it's going to come back. But we absolutely can resolve diabetes. It's fascinating. And it's also fascinating how fast it happens. I mean, I'll tell you a story that happened to me 2 weeks ago. So patient came in, young, and on an insulin pump, incredibly high levels of insulin, over 300 units of insulin on her pump. Wow. And within 6 weeks of changing her diet, she was almost completely off of insulin. And these are stories that repeat themselves every day in our clinic. I mean, the success that we get with these patients with diabetes is nothing short of remarkable. And I always present it in the first day I have a new patient lecture that I give it, and anytime someone's starting our program, and I say, well, let's think about diabetes. I mean, at its core, what is it? What does it boil down to? Right. And it's a carbohydrate toxic state. Right. And when we talk about insulin resistance, which remember is most of us now, that's carbohydrate intolerance. And so what we've got to do to take care of these problems is to remove what's toxic or patients are intolerant to. Other methods are just not going to work. They're only going to lead to more medicine. Sure. And unfortunately, that's how we've approached diabetes. Oh, you have diabetes, you're just going to get sicker and you're going to require more medicine. Well, I completely flatly reject that philosophy and say, no, let's just teach them how to do things differently, and we can resolve the problem.
I had someone once who pointed out to me a very non-scientific person who said, well, this sounds like what we treat our dogs better than we treat ourselves, because we all know that you don't give your beloved family pet, Rover, you don't give him sweets. Why not? Because it doesn't work for him. And we've somehow sort of forgotten that. So
right, absolutely.
Anyway, well, let's change gears a little bit, and let's talk about some of the one of the criticisms, for example, that I hear, and that you probably hear, when we talk about going low carb and high fat. And I have a friend who works with Merck. She's a manager with Merck Pharmaceutical here in Spain, and so we have some wonderful debates. Although she's going to.
Well, Merck will not like it if you go low carb, high fat. Because
no, of course not. Of course not. Although she is now having some health issues herself, and she's in her 30s. She's much younger than I am. And so now I'm telling her, well, why don't you try this? But anyway, her standard thing that the pharmaceutical industry at least has taught her is that you can't go low carb because everybody knows that your brain has to have glucose.
That's true, a little bit, right? But actually, the preferred fuel our brain needs is ketone bodies. So our brain loves to feed off of ketone bodies.
Now, what is a ketone for people who are just getting into this?
Yeah,
Tell us
absolutely.
about ketones, if you would.
Ketones are the byproduct of fat oxidation, which simpler term means when our body uses fat as an energy source, it produces ketone bodies during that process.
So a
Now,
ketone, sorry, could we say if
yeah,
we take in carbs, it breaks down into glucose, and if we take in fats, it will break down into ketones? Is that a fair
that's a fair
analogy?
simplified, yes,
I
yes,
mean,
that's a
simpler.
fair
I realize I'm
simplified
simpler.
version.
There's a lot of
Absolutely.
biochemistry in there, but
Right, right. No,
for
but
the
that's a fair
layman,
simplified version. Correct. So when insulin is elevated, right? Because we were saying insulin is kind of the core of all these problems. When insulin is elevated, it blocks fat from being used as an energy source. So you can't use fat. You can't tap into that plentiful resource because the elevated insulin levels block its use. Now, when you decrease your carbs and you lower your insulin level, I describe it as when our insulin goes up, there's like a big padlock that comes down on all our stored fat. And now that the padlock's there, you can't move your stored fat, you can't use it, you can't access it. You only have one option: add to it. And that's what we do. But when our insulin comes down, those padlocks come off. And now all of a sudden, this abundant energy source is available to be used for energy. And the ketone bodies that are produced in breaking down the fat feed our brain wonderfully. Now, our brain needs a little bit of glucose in addition to the ketone bodies, but you know what? We get plenty of that from our liver because our liver always makes glucose as well. So we get plenty of that bit of glucose that our brain needs in addition to ketone bodies from our liver every day. None of them need to come in by way of food. Now, I'll tell you right now, we don't have patients who are on zero carbs. Okay, I mean, you'd almost essentially have to eat pretty much nothing but meat. I mean, there will be a couple other ways, but I mean, we do have our patients eat carbs, but that's not the source of the fuel for their brain usually. It's mostly coming from the liver. And the carbs that they do eat not only are minimal, but they're coming in way of fibrous vegetables and nuts.
fantastic. So that leads to another question for someone out there who's, once again, new to this. What would be, let's say like a typical patient of yours, successful patients. And by the way, let me for anyone that may have missed this earlier, I wanted to make sure I had this fact right. You mentioned your patient that came in with a diabetic, very diabetic patient with a diabetic pump, and how many weeks was it with that? That 6.
6. I mean, she's down 10 units, not completely off yet. That'll happen
Right.
soon.
Right.
But it's dramatic. I mean, it really does almost happen overnight. This is not something where you're going to have to put in 3 years before you're going to be getting any positive reinforcement and see these benefits. I mean, fast.
That is fast. And how many units of insulin was she on originally?
300.
300. So from 300 down to 10 in 6
Oh, yeah.
weeks.
And
Wow.
that's a pretty dramatic case. But I'll tell you, we go from well over 100 all the time to nothing.
Wow.
So I mean, yeah, I mean, it's almost a little sad in some ways. It's like, why is this essentially hidden from patients in many regards? And that's kind of what I feel like my calling is to say, look, we can really help people, and they don't have to be miserable and calorie restrict and all these things like that. They can still eat and enjoy food and enjoy life and still get a hold of their health. I'll make a little side note here. There was a study that came out in 2011, and it showed this. It made big news and very much excitement. Showed diabetes resolution in only 8 weeks with a 600 calorie a day diet.
Oof.
So
It's brutal
yeah,
and
so
unhealthy and unsustainable.
oh my goodness, of course. So there's two now they did get resolution of diabetes in most patients. I mean, it was a wonderful study, but there were 2 really important observations that have to be made in that study. Number 1 is, I'm sure no one would be surprised, within a month of the study ending, they gained their weight back.
Sure.
Because nobody's going to sustain 600 calories. It's just not going to work. But the second and really important observation is when you broke down what they were eating, they were by default carb restricting. Because even if their percentage was high, when your calories are that low, you're low carb. And so the question then comes, and this argument has actually been made in relation to cancer treatment recently too. Why would we want to be telling people to starve themselves, to be miserable at these low calorie intakes, when really, if we just restrict the carbs, we're going to accomplish the same thing with a lot less horror for the patients and, of course, sustainability. So, it's a very interesting thing, and it not only comes into play with diabetes, but again, as we're learning about carb restriction being beneficial for cancer, and there's more and more evidence coming out about that as well, again, the argument is being made in relation to that. So I think we're going to see a lot of different health facets with this idea and philosophy coming in. The fact that people are healthier when they are consuming lower calories has been known for a very long time. But why is it? Well, it seems to be that it's just because then they're carb restricting, and we can do that in a lot easier fashion.
Great point. Great point. Now let's give an example, if we could, of a typical day. What your patients might, what would be something you would recommend typically for an obese person who comes into your clinic today and they're starting at scratch. They come in, they're ready to go, they're ready to, they believe in your program, and they say, hey, just give it to me and I'll do it.
Okay, so here, a typical day. Let's walk through a typical day for one of our patients, or for me, because I eat this way too. So a typical day for a patient might start out, okay, so our classic is bacon and eggs. And this is what I always say about that to patients. Bacon and eggs is fine. If you like bacon and eggs for breakfast, you can eat that every morning for the rest of your life. But one of the sustainability problems is you got to have a lot more options than that, right? So bacon and eggs would be fine, an omelet, any kind of breakfast meat, as long as it's not overly processed. But we have grocery stores here available where people can get sausage and things like that aren't full of just processed junk. So any of those things are options, but let's go a little bit further, because one of the other things that my patients eat for breakfast are pancakes, believe it or not. And you can make incredibly low carb and healthy pancakes with coconut flour. One of the big rules, aside from eat real food, that we give to our patients is no grains, no potatoes, and no sugar. But that doesn't mean things like pancakes or other baked goods are out, because we use coconut flour, almond flour, flax flour, hazelnut flour, and there's a lot of different things that we can still do. So pancakes are great. Muffins, so they make muffins with those things that can be incredibly low carb. A lot of the muffins recipes that we give are four or five carbs per muffin, high fat. There's just no reason they can't do that. And then I'll give you my favorite breakfast for me personally. I eat cheesecake for breakfast all the time. I make it myself, so of course there's no sugar in it. The sweetener I always recommend is xylitol. And then the rest of the stuff that's in the cheesecake is totally real food. So why not enjoy that great source of fat and protein for breakfast?
Can you share Can you share the recipe with us?
Yeah, actually, I have them posted on, I have a little blog. It's fitteru.us, and I have some of my recipes there, or you can just Google Dr. Sarah Hallberg Facebook, and I have a lot of recipes there. Yeah.
So the blog, so the URL was fitteru.us.
Fitteru, like you, just
yes.
fitter and then a u.us.
Okay.
And
fantastic.
then also I have a professional Facebook page that I post a lot of recipes on as well. So give ideas to people, because one of the things is, especially when you say, I want you to eat lower carbs and higher fat, people always look at me and go, well, what do you mean eat fat? What's that? It's like they're so programmed to avoid it, they can't even fathom what they would eat if they were trying to eat fat. So I have lots of ideas, and cheesecake is a great one. But then lunch, and I tell everybody for lunch, 95% of people are going to eat one of two things for lunch, whether they're on a diet or not. And that's going to be a salad or a sandwich. Mm-hmm. And I say to everybody, they both work. So as long as you keep the croutons off the salad, because that's not real food, and you don't try to use a light dressing, because heaven knows that's not real food. If you put full fat dressing on, salad works. And then a sandwich, I say order it anywhere if you're out, and just ask them to give it to you without the bread. And restaurants don't even think you're weird anymore because people do that all the time. And then a healthy dinner plate in our program looks like protein, which for most non-vegetarians is going to mean meat, but it doesn't have to because we have plenty of vegetarians too. And then vegetables. And if you want dessert afterwards, then you should eat it, because desserts are a fantastic way to get almost exclusively fat in. Lots of heavy whipping cream in my refrigerator, lots of cheese, lots of avocado, olive oil, coconut oil, but these, again, theme here, all real food.
Fantastic. Now, what about supplements? Do you use supplements as something habitually, or does that depend on the patient?
I tell everybody to take a multivitamin. Mm-hmm. But one of the other things is I'm like, just take the multivitamin that's on sale at Walmart. Just take the cheap one. And then I do have them take extra vitamin D, because really, we're made to get vitamin D from the sun, and we just aren't spending that much time out in it anymore, at least not where I live. So I do have them take extra vitamin D, and then maybe fish oil. And the maybe part there is if they're eating fish twice a week, I tell them to forget about it. They don't need it. And then I encourage everybody to eat grass-fed meat. And if we're eating a lot of grass-fed meat, you're good to go with that too. So the fish oil is a maybe for some people who are struggling to get in any of those omega-3 sources.
Right. Yeah, that's so key. Yeah, with regards to vitamin D, there's actually a study they did on Louisiana runners, obviously Louisiana is a very sunny, hot place, so they weren't wearing a lot of clothes while they're. If you're a runner in Louisiana, especially in the most of the year, you are pretty much in short sleeve and short pants.
Exposed, for sure. Yeah.
Yeah. So even among that population who were spending over an hour a day in the sun, or sometimes multiple hours, because some of them were marathoners, they found a low level of vitamin D, even among that population. So yeah, no question.
Think of vitamin deficiency in this country because we're so well fed, but actually we're vitamin D deficient. Many Americans are vitamin D deficient, and I know that extends to the rest of the world too. Because it's a catch-22, right? You get out in the sun, but you got to have your sunscreen on. So.
Right. It looks like, and then there's the other way to, I guess, is to look at it as moderation. There's actually receptors within our skin, and if we're only out in the sun for a little while, but without the sun, without any sun, sun lotion, we can take in that vitamin D, and the question is not to be burned,
Right, exactly, right.
Just moderate, just a little bit of moderation, and it actually, as we naturally get a tan, our resistance goes up. It's just like exercising. We would never, start off exercising someone who's sedentary by going to run a marathon. We would gradually work up to it. So that might be something.
It's just a slippery slope because, of course, skin cancer's gotten a lot worse. So it's just tough because patients, I think that's something patients have a little bit difficulty with the moderation on, I think.
Yeah, we also, moderation is a difficult area for us. Yeah. But there's also some evidence that part of the skin cancer is because the vitamin D is so low.
Oh yeah, there's a lot of evidence with vitamin D and cancer, right? Yeah, absolutely. And that's kind of mounting actually too.
Yeah.
We're finding out more and more interesting things about vitamin D. So I definitely do recommend that people take that as a supplement. That's kind of an across the board recommendation as far as I'm concerned.
Yeah, that's good. There's good stuff there. So let's talk about something different. What about fertility and for example, if you have a woman coming in, maybe who's interested in in getting pregnant down the road, yet she's realizing, hey, she's obese, she's got some health issues, she's got. Have you had cases like that?
Oh yeah, and we've had a lot of pregnancies in our department from people who are having infertility issues, and then it doesn't even take a lot of weight loss, and then boom, they get pregnant, you know. So I definitely think there's no question about it that it helps people with their fertility. Yeah, and then I say to people, you know, this is my feeling about it too. There's not really been a lot of good studies on like ultra carb, like ketosis and pregnancy. But what I tell people is, okay, so maybe you want to go just above that level with carbs, because you got to think about it. What does a baby want to grow healthy? Fat and protein, right?
Yes.
So you're good to go, right? You stay maybe just above ketosis, because then we'll get everybody very excited, you know, as a pregnant woman trying to do that. But just above that is fine. You know, the big things that you want to do to have a healthy baby are basically low carb philosophy. Eat real food, avoid grains, potatoes, and sugar, and eat lots of fat and protein. Brilliant for pregnancy.
Yeah, no question. No question. It's you know, the other thing, I guess that would also help the if we look at the mother's milk, you know, the nutritional profile of human milk, and it is actually naturally, as you probably know, pretty high in fat and
And
low
they're
in
ketotic
carbs.
if they're nursing, right?
Yeah.
The babies.
Exactly.
Yeah.
Yeah. Exactly. The natural milk. So fantastic. Well, now let's look at a few other factors. What about some of the lifestyle factors that this may surprise a lot of people, but one of the single intervention that I've found is the most powerful, that I'm now trying to use with all of my wellness coaching clients, is sleep. And
Right.
and I'm finding some great, even with myself as well, I've been able to increase my testosterone level. A few years ago, actually, I was down to actually the level of a 75-year-old man. I was below 300, and this is what got me back into this field. I realized, well, wait a minute, this is just nuts. You know, the first thing I was hearing from the doctor, well, let's take this cream, or you can do the testosterone injections. And luckily, I knew that, hey, you know what? If I do that, I'm going to shut down my natural production, because you know, the body has a biofeedback system. You start pumping in these hormones, and you throw off your own natural production. And so I decided, you know, I'd rather discover why this is happening before I start adding in some synthetic hormones. And just by improving my sleep, I was able to get up to it was over a 50% increase within 4 months. It's not overnight.
Yeah,
But
right.
is that something you emphasize with your people?
Absolutely. And so we know testosterone, there's some pretty good evidence that it goes up too when people lose weight and they start eating healthier, that it does go up. And then as far as sleep goes, I mean, you can't separate sleep and health. You know what I mean? You could have the healthiest diet in the world, and if you're not sleeping well, then I still would say you couldn't be considered healthy. But one of the other things that we really find, an interesting thing with sleep, is people sleep better when they cut their carbs out. They tell us that all of the time. So I definitely hear improved sleep, a constant theme with our patients. Now, I got to be honest with you, you know, I always go by the data, and there's not a lot of data on this yet. It's going to be interesting to see what comes out of this in the future. But I can tell you with just my clinical experience alone that people report improved sleep. And that's important, because sleep's got to be part of the whole system. Now, a lot of the times, this improved sleep also is the fact that we take care of people's sleep apnea, right? Because they actually, a 10% decrease in weight equals a 50% decrease in sleep apnea. So one of the big
Wow.
bonuses that people have is that as they lose weight and they start to feel better, their sleep apnea resolves, and, you know, lo and behold, all of a sudden their sleep is improved.
Wow, that's
So yeah,
amazing.
I would say that's another one of those multifactorial wonderful parts about eating healthier, is it improves your sleep, it resolves the sleep apnea. So we've just got, you know, the fingers in with good healthy eating, just go into so many different areas of people's life.
Wow, that's interesting. You know, there's a gentleman, actually, he's a MD who is involved, is an ex-Navy SEAL down in San Diego. His name is Kirk Parsley, and he's on Twitter at Doc Parsley. We did an interview last month. Great guy, and his focus is really on sleep, and he found that's been just super powerful. And he's done a bit of research or had someone help him with that. One of the things he talked about was that a study he had run across that showed that chronic sleep deprivation, and I don't remember the exact hours that they stipulated, but would be the same as for example, if a surgeon was sleep deprived, or especially someone doing residency and you're in the hospital 24 hours, but you can have a cognitive decline similar to having a shot of whiskey.
Oh yeah, like drunk. Like actually, I think in some cases it's a lot worse. Like if
worse,
they test
yeah.
driving, sleeping versus drunk, that the sleep deprivation makes them actually a worse driver. Yeah.
Yeah. So
that doesn't surprise me. Sleep's important. It's so important.
He's found that's been his number one biohack with the Navy SEAL teams that he works with. They're out there in San Diego, and of course it's harder I think sometimes from my experience with males, because we tend to think it's almost like we wear it as a badge of honor. Oh, I only slept 5 hours last night, but here I am, I'm ready to go, and I'm jacked up on 3 coffees, and okay, I can power through the first half of the day, but. But then that afternoon, what's happening to you then? And then you get into that vicious cycle, right? Then you go back, you have another coffee in the afternoon. The half-life of the caffeine carries into your sleep time. So now you don't sleep well. And then you wake up sleep deprived again. And you go back and you get, you start, and then that leads to, adrenal burnout. I've seen that with.
There was an interesting study done recently. I can't remember the guy's name. I just watched a TED talk on it with sleep, where research was done, and one of the interesting things he found with sleep is like our brain does not have a lymphatic system in there, just like the rest of our body. So when we produce waste, it goes into the lymphatic system and gets disposed of. But our brain does not have a lymphatic system. And what he found, and it was incredibly fascinating, is the way our brain gets rid of waste is that it goes out into the CSF, the cerebral spinal fluid, and then it gets disposed of through there. But the cerebral spinal fluid only seeps into the brain to collect this waste when you are asleep.
Wow.
So if you don't sleep, your brain doesn't get cleaned, if you will, and then that can cause all kinds of problems and fogginess, cognition issues, So, very fascinating stuff. But yeah, we can't separate sleep and health. They're one and the same.
Yeah, that's fascinating stuff. So, and also it helps, with with insulin regulation. In fact, I think sleep deprivation is also creates insulin deregulation, and
hormones lots of different hormones are affected by lack of sleep. Mm-hmm.
Yeah, no question. Okay, well let me see how we're doing time wise. It looks like I know you've got an important family obligation coming up. So we should probably start wrapping it up a little bit. I mean, there's so many great topics we'll have to get you back on the show again in the future, so let's just sort of wrap things up. We've talked about nutrition, we've talked about sleep, we've talked about supplementation. Is there anything else that you'd like to add? Anything new that you're working on or interested in that for the future that you could tell us about?
Yeah, so I hope to, if I come back, I hope then next time to be able to talk about a couple of research projects that I'm working on. So we're going to be doing some very specific looks at some of these diabetes resolution number. And
wonderful.
We've got so much data to be able to hack into right now, available to us. So the next big project is going to be producing some good research papers out of this. Again, and one of my big focuses is to show with our numbers that calorie restriction does not need to occur. We can do it all with just carb restriction and less misery. And then also have a project coming up on looking at swimmers and a ketogenic diet too. So really interested in translating all of my clinical success into some research that can be helpful to the field as a whole. So really looking forward to that in 2015. So that's pretty exciting. But of course, continuing what I enjoy most, which is working day to day with the wonderful patients that I have, and sharing in with them continued success.
Wonderful, fantastic. Well, I really look forward to seeing that research. I'm sure many professionals would love to see that. And in your experience, is there actually anyone that's done any? We talked about the one bit of research with a really low calorie diabetes resolution study, but is there anyone else that's done anything with with a low carb approach to diabetes as far as research?
Dozens. There are dozens of studies out there, and they're very consistent results within the studies. So, the big goal with more research is to get a much bigger N size. More
Right.
patients enrolled in them. But yeah, there's actually dozens of studies. There's a number of groups that have done some really nice work on this already. But again, I hope to add to it because it's very difficult to change the status quo, right? So
Yes.
in order to do that, we've got to have a lot of good data. So,
Well, fantastic. Hopefully, that will make maybe some of the masterminds at the American Diabetes Association and the other organizations might actually start noticing this.
oh yeah, right, exactly. That would be the goal. That would be the goal.
Wonderful, fantastic. Well, Dr. Sarah Hallberg, thank you so much for coming on the show and sharing your wisdom, your experience. It's been wonderful, and this will be going up on YouTube probably next week, and then it'll be going out on iTunes early January when we're actually launching there. So we'll stay in touch, and good luck with everything.
I appreciate it.
Oh yeah, my pleasure, my pleasure. So have a great day there, and we'll see you online.
All right. Happy holidays.
Thank you. Same here. Enjoy your thanks. By the way, are you going to have any low carb Thanksgiving recipes going up that for people that can?
Yeah. We have. I mean, I always say we've got a little cookbook that I had put together. I've got to get it online. I haven't gotten the whole thing online, but there's absolutely nothing that you don't see on a traditional Thanksgiving table that you can't have low carb and real food.
Oh,
so
that is great to know because that's an area that I am deficient in is recipes because I'm kind of got my own things and I'm happy with that, but I've got people that family and friends and customers of mine that will benefit, so I'm going to send them your way to check that out.
All right. Thank you.
Fantastic. And then lastly, I'm going to throw in there for you. You've got so much great information. In the future, consider doing a book.
Okay, yeah, maybe.
You can do it this will be great. Once you get that research done, it'll be the perfect time because then you can get into that, promote that book, and that promotes all this great information you've already got.
Yeah, I mean, anything to disseminate information is just my top priority because, like I said, my wonderful patients, we should be able to see lots more wonderful results with people just outside the small group that we see. So yeah, absolutely.
Fantastic. Well, once again, thanks so much, and we'll stay in touch.
Okay.
All right. Bye-bye.